Okay, so let's switch over to the opposite end of that, since our topic today is supposed to be for menopause, right? So,
right. But it's all a continuum. I mean, to me, pregnancy,
yeah,
menopause, it's all just
yeah,
different phases in life. And I'm like, I can pretty
yeah.
much take my entire menopause book, pull out a few oils, and republish it as a pregnancy book because it's,
Right,
they're not that different. They're just
right.
the beginning and the end, and there's one day between them. There's one day between
So,
fertility and never mind.
so menopause. Okay, so menopause. Obviously, we've got a lot of things changing, and I know some of the top things I hear about, obviously, are the hot flashes. That's probably the biggest thing. The night sweats, the not able to sleep at night, and I'd say those were probably the top things that I hear about. Right? Um, what do you what? So, what are the essential oils like? So, what would we recommend for that? Um, I mean,
Girl,
I
you
have
need my
things in
book.
here.
There's like 300 pages in the book. And the book is sectioned by like what your problem is because people
Ah,
have people actually don't connect a lot of their issues to menopause. They'll be like, here's what I hear all the time. Almost every day, someone's going to come see me and say, I didn't have a bad menopause. I just had hot flashes for like a year and they weren't that hot. And now I'm fine. And I'm like, oh, well, let me look at all your medications. What's this one for? That one's for my osteoporosis. Okay,
oh
what's
my
this one
goodness.
for? That one's for my
Ah,
blood pressure. What's this one for? That one's for my diabetes. Okay, did you
oh
have
my
any of these
goodness.
before you were 50? No. I'm like, okay, those are your menopause presents.
Yeah. Oh
Oh,
wow.
they do not connect that. They lost their hormones, then their body started struggling, and here's all these new drugs they're getting. And I'm like, no, well, we could have done a different thing. Like,
Yeah, that makes me
especially
so
blood
sad too,
sugar.
because
There's a lot of,
most.
oils for blood sugar. What if you'd been taking
Mhm.
cinnamon 5 years before that diagnosis? Would you have still gotten it? I don't know, but maybe, you would have had a chance, right? So there's a lot of
Right.
things they don't connect. Like, you got to start your body's going to do certain things, and because all your friends have certain things, and if you want to avoid those things, I mean, your lack of hormone is a big part
Mhm.
of it. And could you take progesterone? Young Living has progesterone. Even though it won't be the amount you used to have, it still helps you.
Exactly.
It
Yeah. No,
could.
and it's like I'd rather any day people, take nutrients, vitamins, essential oils, use all of those things, versus getting on some of these drugs. Because once these drugs, the side effects are just,
I
yeah,
know. And then they come in on like, so they go make it to 40 with nothing. And then they come in at 50 and here's 10 drugs. And I'm like, you're on 10 drugs and maybe I couldn't have saved you from all of them. But there are certain things that had you been doing them 10 years ago, you might only be on 5 drugs. And then some of
five
the drugs are causing you side effects. And you got on 2 of the drugs because of the side effect. And
side
so
effects.
there's
Hmm.
all this pre-planning. Like there's stuff I knew at 35. I knew what was coming because I saw everyone else getting put on stuff, and I'm like, I will be a hot mess if I have to be on. I was like, I don't want that, and let me start reading now and defending myself
Hmm.
against what is going might happen. And my family has I have a terrible history of cardiovascular disease, so I knew I had to be all over that diet,
Right.
nutrition, vitamins, and then the oils came later. But I was like, there are certain things I should have been doing with oils. So I knew about them, but I was only using them for skin and topical stuff, not really for other problems. But I'm like, there's stuff I should have been doing with those oils 10 years before I started doing them.
So, okay, so what would be, here's a good question. What are the top three things you should do as a 35-year-old, before menopause is even a thought?
Right. Okay. So at 35, you start losing bone. Even though
Hmm.
if I do a scan on you, I'm not going to see it, but we know that you build bone until you're 35. And then after that, you start losing it. And then by the time you're 50, 70% of women are going to have visible loss, like it's going to be osteopenia or osteoporosis. And I knew
Okay.
that. So I was like, either increase calcium in your diet. A lot of people don't like milk. Oh, I don't want to drink milk and yogurt's fattening. And so but you have to either really put calcium in your diet or start taking a supplement, the end, or magnesium. I know that I'm low in magnesium, or not low, but I mean, I know that my body demands a lot of magnesium. So
Mine too.
right. I can literally suck down like 1,000 milligrams and be like, my body will take some more. So I've been using get it, put a magnesium in your bath, do some Epsom salt
Hmm.
bath, take a liquid magnesium, whatever. But like a lot of people don't take enough in their diet. And if you're low in calcium and magnesium and wander around between age 35 and 50, not on either of those things, you're in line
It's going
for
to
the
be a
bone building
challenge.
drug. And you're going to be mad when you get the bone
Yeah.
building drug. You'll be like, now what should I do? And I'll be like, well, go back 15 years. And then, we don't want to
Right.
do that. So I,
Well, I
I
have
wrote
to
the book
say,
because it's for that purpose. So like when
to
people say,
prevent
what am I
some
going
of
to
that.
do? I'm like, well, here's the next disease. And why don't you start studying for that? Because
Hmm.
that's the problem.
Right.
Study guide for
Well,
what you should be
so
doing.
now what's interesting, because I am not a fan of some of these prescription bone drugs, right? Some of the side effects are just not good. However, there are some products, natural products, that they've done like studies side by side against these bone drugs, and they've been able to basically have the same results without all the side effects. So I've had patients on some of those, which is amazing. I've had one lady that was osteoporotic, and she's reversed that some. Her numbers have actually changed. She's now considered osteopenia, which is exciting to me, and she's but without all the side effects, because that boat just kind of honestly scares me a little bit. Bone cancer, I don't know.
Right.
So
Well, yeah, even like when I, I started, had just come out, so it didn't have all
mhm,
the bad data. But just
right.
the fact that somebody, even you walked in and someone even said you needed it, and we were using them for prevention also. You didn't even have to
Hmm.
have osteoporosis. You could have osteopenia. You could have a bad family history where we're like, just take it now. But
Yep.
I was still like, you're missing the bigger picture. You still need to take calcium and magnesium. So why weren't you just already taking it and avoiding this
Right.
diagnosis? It's not like
Right.
this does not get you out of needing those two things, because both of those things are good for blood pressure. So here
Right.
you are going to, take,
That's
you still
true.
haven't done what you were supposed, what your body wanted you to do. And you're in line for some more crap that you don't want, and
Yep.
you'll be sad about it. That's the problem.
Yes. Very, very true.
So that's always my
Very,
problem.
very
It's like,
true.
you are not going to get out of taking these vitamins. You're just going to get a pill and the vitamin, or you're going to take the vitamin early enough to maybe avoid the pill. But if you
The pill.
don't,
Hmm.
that's just, those are your
Yeah.
two choices here.
Yeah.
You don't have
No,
a third. That's the choice.
that's very, very true, and it is interesting because, yeah, it's an interesting conversation, I guess,
Yeah.
having to tell people that. Okay, so is there, okay, an oil or um, a regimen around oils that you would add to that mix?
Well, see, the thing I like about Young Living stuff is that they put oils in it. Like they have Idaho
Hmm.
Blue Spruce in their Super Cal Plus product. And spruce I highlight in my book because pine and spruce and all those things in that family are studied to increase testosterone. So, and men don't get osteoporosis like women do because the testosterone builds them thick bones. It takes them so much more loss to get to that point. Whereas we have
Like
thinner
men.
bones, and it's easy for us to lose a small percentage of bone and be like, look, we have a new diagnosis.
What's fascinating though, we're starting to see men having osteoporosis now though, because even their testosterone levels are
Yeah.
so low.
Younger.
It's really crazy.
Yeah, men at
Way younger.
35 can get low T, and then they're,
Oh,
and whereas women, our testosterone isn't that high to begin with. But so I like their particular calcium blend because it has the blue spruce in it, which is just because taking the calcium without a hormone, it doesn't know where to go. You just assume
right.
make calcifications in your body or pee it out. But if you have something in it that gives you any sort of direction, it's much easier, and
Yeah.
then it's got, a few other things in it. But I mean, that's one of the big things I like, is that it already has like a testosterone promoting oil included in the blend.
That is very cool. Now I have some. I've been using that calcium actually lately, along with like 30 other brands of products that I have. You know.
Of course you do. You have a lot of different brands. But yeah, but like I said, whenever there's an oil in something that's going to help me do, I was like, oh, just going to roll with this. And then they have
Yeah.
Agiles, which is good for joints, and it's got collagen in it, type 2, which is good for bones, and
Okay.
glucosamine, hyaluronic acid, which is good for joints. So it's a really good joint supplement. And it's got the
Very
spruce in it again for, testosterone. So, and turmeric, anti-inflammatory, and boswellia, anti-inflammatory. So I like a lot of their bone stuff. It was really interesting.